Hey guys, I'm Dr. Rahul Khare, emergency physician and founder of Innovative Express Care. I just wanted to talk to you guys about our serology testing, our antibody testing, as they say. We started this a while ago, over a week ago, and I wanted to give you an update and to let you guys know that we're doing a huge amount of antibody testing, and we just opened up like over 300 different slots for everyone. So I know a lot of people were frustrated they couldn't get in. It was new. We had limitations on it, and now we don't. So I want to let you know about what we're finding, how you can make an appointment. So I'll keep this quick. First and foremost, what is antibody testing, serology testing? What does that mean? Basically, it means that we can test if there are certain antibodies in your blood that have come in contact with COVID-19 virus. That's it. That's all it really means. So if you've been exposed to COVID-19 and your body has made a antibody to it, has responded to it, that's actually a good thing. And what it shows is that you are very unlikely to get it again. Now, it's important to say you don't have 100% immunity. We're still learning a lot about what antibodies actually means. But if you've had it, the likelihood of you getting it again is very low. So just realize that, understand that, and that is why it's very important. So next, the question is, who should get it? Well, I think all adults should get it. And the reason why adults is because children have very, very few complications from COVID-19. They certainly do get it. It can cause issues, but it's a very low likelihood. And we've learned this over the last few months. Secondly, this is a blood draw. And, why let your kids have to go through that if it's not absolutely necessary? And then lastly, I think it's really important to know that it is a blood draw that will help you identify if you've been exposed. So please, please, please think about getting it. Think about having family members get it. And if you want your children to get it, I say we've made a rule that it has to be 10 years old, 10 years or older. We really don't want to do a blood draw unless it's absolutely necessary. I do think in about 2 to 3 months, we'll be able to use these finger prick testing, and I think those will be good for kids. Right now, those are not reliable. We've used them before, and it leads to the next question. What tests do we have? We're going through the laboratory of Quest Diagnostics, one of the biggest labs in the country. It's a very trustworthy lab. But more importantly, they use a lab instrument made by Abbott. And Abbott makes one of the best, one of the highest standards of antibody testing. They have an FDA emergency usage authorization for this. So that is the highest FDA approval that anyone can get for antibodies. There are no true FDA approved tests on the market because these things are coming out so quickly. And then what does it cost? Well, the good news is we're finding that insurances are covering mostly everything in this test. So we have figured out the codes that to use, and so far they've been covering up to 100%. Sometimes they still want copays, but that should be $20 to $30. And then they're covering the lab as well as the visit. You have to check with your provider to make sure, your insurer to make sure, and we have given you the codes on our website. So how do you book? Go to our website. You can just Google Innovative Express Care and then click on the COVID-19 section. You'll see it bright in red on there. And then click on antibody testing. It'll take you through everything. There's a frequently asked question section. I would recommend you guys reading it. It tells you about the test. It tells you about insurance codes, costs, things that are frequently asked. And then I recommend everyone to get it. It'll give you an idea if you've been exposed. That cold, that cough, the slight fevers, the body aches you've had in the last 2 months. The question really is, if you haven't gotten tested for COVID-19, was that COVID-19? Were you around it? It definitely was a pandemic. It was around Chicago, but this test will tell you if your body has made antibodies to it and if you've encountered COVID-19. And it's important for you to know. for the risk levels that you carry going to see elderly patients or elderly people or people with comorbidities such as coronary artery disease, diabetes, things like that. So that's all I got for you right now. Please book your appointment. And this is the most important thing. We have streamlined it so you actually talk to somebody via telemedicine. You talk to one of my providers or myself via telemedicine, and we make sure you don't have the symptoms for the last 14 days. Because if you had symptoms for the last 14 days, you don't need the antibodies. You actually need the COVID-19 swab. And we determine that by just talking to you. Most people will get the antibodies. And if that's the case, we direct you to our offices where we will quickly just get your blood drawn and get you out. Usually the process after the telemedicine visit, which is 10 minutes, the process to get your blood drawn takes on average 4 to 6 minutes. Sometimes there's a little bit of a wait, but we social distance and we have people 6 feet apart, and everyone is in masks, either your own or we provide one to you. You go into a clean area where there is no testing for COVID-19, just the antibodies, people who are screened just like you who have no symptoms. So believe me, it's been thought about. We use the best test. We've been doing this the longest. So come visit us. We have a bunch of tests open. I think on Monday we have 70 slots open. I have over 8 providers working a day through telemedicine to help you all. So I look forward to seeing you guys and paying a visit to Innovative Express Care. If you have any questions, please drop us a message on this Facebook page, or if you like, email health@innovativeexpresscare.com. I take a look at this. We have a team of people looking at those to answer questions. So let us know if you need anything else. We really hope you enjoy our process. We feel like we've streamlined it and has made it as safe for you as well as our providers. One great news that I can say is that I have tested antibodies on every single one of my providers and medical assistants, as well as receptionists, everyone in the Innovative family, from the wellness clinic to the everywhere, and we have 0 antibodies. So my employees aren't too happy. They wish they had antibodies, but we have been very safe using personal protective equipment, N95 masks, these huge moon suits, these astronaut suits that we're all wearing, and it's been very safe for them. And I'm really proud as the owner to have no one be positive. So let us know if what else you need, and we look forward to seeing you. Bye now. Be safe.